Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Sarjapur and Belandur units of Bangalore. Antenatal consultation and checkup. It is a very important part for the pregnancy to go smooth and to identify the high risk factors. Why is it antenatal checkups are important? Medical evaluation of the pre-existing diseases or so many diseases are first identified at the first visit of the pregnant antenatal checkup. So many women, they may not know that they have thyroid problem or sugar, or the first time they would be checking their BP, which is so high. So these factors which can be early identified and treated appropriately, it is so the importance of antenatal consultation lies. The WHO tells that up to 7 months every month you should meet your doctor, provided if any complications early also. After 7 months, from 28 weeks to 36 weeks, 2 weekly once. After 36 weeks, weekly until the delivery. It can vary in high risk pregnancies. So why it is important to go and meet a doctor? What the doctor will be checking in each visit? The vitals. What is your weight? What is your BP? Is there any change in happening? Is there sudden weight gain in you? Because it depends on your BMI. What is your height and weight? BMI is calculated. If it is underweight women, we can allow them to gain 12 to 15 kgs of weight. Otherwise, 10 to 11 kgs should be normal. If the BMI is more than 35-40, for those kind of women, we tell best is not to gain. If at all, if they gain less than 5 kgs gain in the pregnancy is best for the good outcome. Because sudden rapid weight gain, if it is happening, we have to see whether the woman is at high risk of developing hypertension. The hypertension before developing, the first thing in body will occur is the edema, water retention. So you can observe in your face, like as soon as you get up in the morning in the late part of pregnancy, if you see that there is edema around your eyes or your legs are swollen, or rapidly you feel that you are feeling too much bloated or weight gain, your clothes are suddenly getting too much tight. These kind of scenarios, you can check BP at home also or check your weight, because these days everybody is health conscious. Majority of the antenatal women have BP machine and weighing machine at home. So you can check that if there is a sudden variation, meet your doctor immediately, because hypertension is such dreaded disease. Because of placenta, anytime the pregnant woman can get BP, mainly more so after 28 weeks. In cases of high-risk pregnancies like IVF conceptions, or the woman who has diabetes, or the growth-restricted babies, or the patients with Apla syndrome, thrombotic events, or the renal disease, these kind of women suddenly post 28 weeks, sudden risk of developing hypertension will be there. So to identify these kind of things, regular visits and regular consultation is very important. Whatever the tests said by your doctor, do it on time and follow it up. If you feel that your office is there, you're busy or not able to go and meet in person, or you're tired to go, you send your husband with the reports to consult the doctor whether anything else to be added. So these things is very important. And monitoring of the fetal movements, and if it is less, you have to meet the doctor. In checkup, if clinically the doctor feels like, so many times need not always ultrasound needs to be done. On your examination, if the doctor feels the uterus height is lesser than the normal, these kind of things can be early picked up. So only consultation is important, because doctor clinical examination, so many things can be diagnosed. If the doctor feels the uterus height is lesser than the normal expected for that gestational age, doctor can request for a ultrasound growth scan and things. So early identification of growth restriction or the fluid around the baby, if it is reducing, these things can be identified and better managed with progesterone, with the protein support. The fluid, if it is less, the amino acids and vitamins and proteins can be added. So this way, regular consultation with your doctor is very important. And in each consultation, the vaccinations which has to be given in pregnancy, the main 3 vaccines what we give, tetanus will be given, influenza vaccine will be given, and the Tdap vaccine which will be given after 26 weeks. And there is a other vaccine for the Rh negative women. Initial visit also Coombs test will be done, and ICT test at 28 weeks also will be done. If it is negative, to take immunization vaccine, anti-D vaccine is very important. So for these reasons, regular consultation and checkups with your doctor, and in case of twins or high risk pregnancy, the visits may be little more frequent after 28 weeks, because there will be a problem which has to be identified, or the babies need frequent monitoring. So for this reason, follow the instructions given by your doctor, and good antenatal checkup can diagnose so many problems early, and good outcome can be gotten with this kind of problems.